chiropractor Dr. Gregory Johnson, and we have Stephen in here with us this morning. And Stephen is suffering from a condition which is commonly known as DISH, which stands for Diffuse Skeletal Hyperostosis. And what that is severe degenerative joint disease, degenerative disc disease. You get spondylosis, which is a increased amount of calcium and spurs developing along the edges of the end plates of the vertebrae, superiorly and inferiorly on the vertebral bodies. Now, if DISH is not caught early enough, it can actually fuse the spine together. So this is Stephen's third treatment in here, and when he first came in here, I mean, he had absolutely zero range of motion in his cervical spine. And this is his third treatment. So we're going to show you how we treat a patient with diffuse idiopathic skeletal hyperostosis, DISH. Okay, so let's have you close your eyes, Stephen, and bend your head forward and backwards. Now, believe it or not, that is about 100% better range of motion than he had the first day. Now, neutral.
Yes.
I know it doesn't look like much, but whenever you have this condition and you know how you cannot move your head, you can't even look out the window to see which car's coming down the lane next to you.
No, you cannot. That's for sure.
It interferes with a number of activities of daily living in our normal everyday lives. And it's a condition that I'm not going to fix or cure, but we can improve his range of motion and his function, which he's already been seeing.
Yeah.
So first thing we're going to do with him is I am going to decompress him. Now, it's interesting because we had okay, let's lay on your back. We had a chiropractic student make comment on one of our YouTube videos, wanting to know and making a comment that it was not necessary to adjust everything that I adjust. The reason that I adjust everything that I adjust in 3 dimensions, and including the shoulders, the clavicles, and the ribs anteriorly and posteriorly, as well as doing the spinal decompression on the y-axis, this is really the only way you can make changes in the y-axis, which runs down through from plumb line through the ceiling to the floor vertically, horizontal if he's laying down. So I'm going to get this towel right on his occiput. Now, he's not completely fused yet. There we go. Did you feel that all the way down?
Yes, I did. Yeah,
okay. There we go. There we go. And I don't do the reflexes just to see if they're still alive. I just do them to check them out. Okay, relax this in my head. Now, on this adjustment, you notice I'm not going to rotate it so much as I come in straight from the rear, P to A, which is more of a Gonstead type of adjustment. I got you. Drop it in my hand here. There it is. Good. So, my line of drive is different. It's coming from the posterior aspect to the anterior aspect, which is called P to A. There we go. And that hurts less than when I rotate it, doesn't it, Stephen?
Yes, yes. Oh, it feels good though.
So, even though it may look like I'm doing the same thing, the contacts are different, the angles are different, the thrust is different, everything's different. Let's go in your stomach first.
Yeah.
What is?
Oh, yeah. I was talking about.
Well, I mean, all these idiots say, oh, he does the same thing on every patient, and they don't know what they're talking about. So I am adjusting his SI joints because his right leg is short by about 1/4 of an inch. So I'm adjusting his both SI joints to get them moving. That's why I adjust them. and the sacrum in the center, straight superior to inferior, away from L5, which also realigns and helps line up the S1 and sacroiliac joints. L5, L4, L3, because these all retrolestes, which means they slip backwards, and that's where the nerves are. There's L1. Yeah. Keep breathing. Don't hold your breath on them. There we go. Now, his disc is throughout his entire spine, which can eventually lead to a condition called ankylosing spondylitis, which, if you remember Bruce on his videos, his had already degenerated to a point where he was completely fused from his skull all the way down to his sacrum, so there's nothing that I could actually do to help him. However, Stephen, legs are even now. This should feel a little easier than the first one. He's at a point in time in his spinal degeneration where I can still help him increase his range of motion. Now I'm adjusting PA, which is posterior to anterior, in the lines of the facet joints here. And there's T1 actually to bring his whole head up and back beyond that. Let's turn you on your back now. Now the first day Stephen came in here, he couldn't even lay his head on the headpiece. Remember that?
That's right.
It wouldn't even touch the headpiece. It was just sticking straight out. So see, it's still pretty stiff. So I'm still bringing it up and then externally rotating it into extension to improve his range of motion. Now slide down this way about an inch and put your arms out to the side.
That right there?
Yes, sir. Palms up. Now, why I adjust both shoulders and clavicles and anterior ribs? Because I am lining up the entire body. Some people say that's not being specific, that's being comprehensive to me. And just ask our patients what they prefer. That's why we have so many people coming in here that have seen other chiropractors. Because I do all these adjustments, and there is a reason for doing them. Because if I just adjusted his neck and didn't adjust his ribs or his lumbar spine or his SI joints, they will compensatorily subluxate him in other areas of his spine. There you go. Should have felt that in your knee all the way to your low back.
Yep.
Same thing here. There we go. Good. Okay. Good. Let's set you up and face that away. There we go.
There we go.
Yes, I want to adjust the shoulders, elbows, and wrists too. He's got some limitations in his range of motion there as well, but they're adjusting good. Have you been to other chiropractors before?
Yeah, I've never been adjusted like this ever.
So
it's good. It feels good.
So when I adjust everything, like I do,
yeah.
Does that feel better to you than getting the limited adjustments that you've had previously?
Yeah, I feel good when I walk out.
There we go. Okay, let's have you take a look in the mirror here again. Now see, his posture's already improved. Let's have you flex forward and backwards again. Range of motion is already improved. Yep. You couldn't even do that the first day.
Nope.
Let me have you. There you go. Now see, I'm bringing him back a little. Keep those shoulders pulled back. There you go. And y'all are still asking what this instrument does. I'm adjusting the atlas on the x-axis. Okay, relax. With the instrument, it's a high velocity, low amplitude thrust on the atlas on the x-axis that sends a barrage of neurological proprioceptive information through the vestibulocochlear apparatus into the cerebellum. The cerebellum controls balance, posture, coordination, and all kinesthetic movement throughout the body. Okay, let's have you flex forward and backwards again.
All I know is it feels good.
Just your neck forward and backwards again. Now that's the best I've seen it.
Mm-hmm.
And you have some extension where you didn't have any before.
No, that's correct.
Take a look in the mirror right now. You're right down the middle everywhere. Square it up.
Mm-hmm.
So Stephen, what would you share with our YouTube audience about how this has improved your condition just in 3 visits?
3 visits, like you said, I was really sore when I first met you.
Yeah. Well, you couldn't turn and look at me like that.
And when I drive daily, it's hard for me to
Look out the window, see other vehicles.
But in 3 visits, I mean, it's like you said, you're never going to correct it,
Right.
or fix it, but I can manage.
Helps you function better.
Yeah, absolutely.
And that's really what we're all about here at Advanced Chiropractic Relief, is helping people reduce their pain and function better on a daily basis.
Thanks.
You're welcome. And this is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. There is a reason we do what we do, and there is a reason we're called Advanced Chiropractic Relief. Home of the Super Bowl. We'll see y'all soon.